Hi.
Good morning. My name is Kathy Kendall-Tackett, and I'm the editor-in-chief of Claris Press. And today we're interviewing Donna Walls, and she is the author of the book Growing Green Families, which is available on Amazon and is available at clarispress.com. And a question that actually has come up a lot is, what about aromatherapy? It's something a lot of people are interested in, and I think there's a lot of misinformation out there. Sometimes people think that, they read a book and suddenly they're certified in this topic. And I think there's a little more to it than that. And Donna is actually not only a nurse and a childbirth educator and lactation consultant, but she's also certified as an aromatherapist. So, Donna, can you tell us a little bit about the certification that you received as an aromatherapist and what kind of was involved in that, and sort of what is your background?
I was glad when I really got into this certification, and my certification comes through the Australasian College out of Oswego, Oregon, and it's an 18-month course. And what made me feel good about this course is that we went through each body system. So what are the oils that are going to help this? How is it applied? How does it work? What should you do? What shouldn't you do? And I think at the other end of it, when I came out, I felt very good about it. It's kind of nice to have a nursing background when you have the anatomy and physiology and pathophysiology to go with it. But I think it really gave you an appreciation. And what I feel like is I'm concerned about now is that what I'm hearing out there is the use of essential oils, and they're not really being used respectfully or honorably. Essential oils are by nature extremely concentrated. One easy way to kind of think about how strong these are is that one drop of an essential oil equals about 75 cups of tea. So it kind of gives you a little idea about the concentration. So our bodies aren't really designed to use much of things that are that concentrated. Smaller amounts is what our bodies are more able to handle. So one concern that I have right now is I'm hearing people talk about especially oral ingestion. And I'm hearing things like taking 10 to 15 drops of essential oil, put it in a capsule and take it. That's really tough on your liver. It's tough
Yeah.
on your kidneys. And I don't know if we're really helping people. And honestly, when we're talking about the oral ingestion, there is a risk factor there. And it's a risk that we don't need to take because all of the essential benefits, all of the wonderful things that these essential oils can help us with to be healthy, you can get either through inhaling or through applying to your skin if it's properly diluted. So there's really no need to take that chance on oral ingestion. One of the things that I think frightened me probably the most was that as a lactation consultant, I was hearing some of the people in my field talk about applying lavender essential oil to the nipples for sore nipples.
Yeah.
And I said, oh my goodness, the baby is going to eat that.
Yeah.
And their response was, I know, but it's pure.
Right.
I'm not trying to be flip about this, but I said, well, you can get pure cocaine and that's not good for you either.
Or
So
pure
purity
arsenic.
is not the issue here. It's the concentration.
Yeah.
So, and again, there's just no need to take that chance when you
Right.
can get the healthful benefits that you want in a safer form. So generally speaking, and I teach aromatherapy classes at our local community college, we talk a lot about the safety of essential oils. And I think it's really important to make sure people understand that. There's lots of benefits. I love all the essential oils. I carry them in my purse. I travel a lot. They're always with me when I'm traveling, and they're part of my everyday life. But I think they have to be used honorably, and that's the part that's kind of scaring me a
Well,
little.
it's sounding like, the oral ingestion, you don't recommend that at all, that people take
I
that.
really don't. I
Yeah.
really don't. Some places in Europe where they use a lot more natural products than we do here, I have seen them talk about put maybe one drop of peppermint oil on your tongue to aid with digestion. And I've seen some things. I've seen some research. That may be okay. But again, I don't know for sure that it is. And so don't think you're going to get any better result. Apply it, put it in, make it into a nice little massage oil, rub it on your belly, sniff a little bit, drink some peppermint tea. All those things are going to get you the same kind of thing.
Or fennel tea, actually, for that matter.
Fennel tea is another great one. So there's just so many other alternatives that are so much safer. That I really hope people are looking into those kinds of things. So
now, are there any ones that you wouldn't actually recommend applying directly to the skin? I know cinnamon actually tends to be fairly irritating on the skin. Are there any other ones?
We can make this really easy. There's only 2 that you should not dilute. Everything else should be diluted before you apply it to the skin. And those are lavender and tea tree.
Okay.
So lavender, you can use neat or straight on the skin. Tea tree also, you can use neat or straight. The only thing with tea tree is that it can be really irritating. So tea tree is used a lot, like for acne, when you get blemishes or, those kind of things. And I say, so it will do the trick. I'm a nurse, I work in maternity, and if I have a little herpes on my lip, I can't go to work. So I put that tea tree on right away, and it works really well, but it can leave this great big huge red ring around wherever you are from the irritation. So just a little word to the wise there. But there's lots of good ways that you can use it. Everything else should be diluted. And the general rule for dilution is 1 ounce of a base. And your base oil can be olive oil or jojoba oil or sweet almond oil or apricot kernel, whatever you want. And you put in 1 ounce of your base, usually plant-based oil. We really try to avoid mineral oil and petroleum-based things. And then you put in about 20 to 30 drops of your oil. And that's for either one oil or a combination of oils. A great headache remedy is 1 ounce of a base oil, and you put in 15 drops of lavender and 15 drops of peppermint. This is for a healthy adult. Okay, mix it up and apply it to your temples, or you could rub it on the back of your skull, or pulse points, or acupressure points, those kind of things. And it's a great way to help with headaches. But again, that dilution factor is really, really important. So that also is adjusted if you have people who are vulnerable or fragile health. It needs to be adjusted for children, and it needs to be adjusted for pregnant women. So in those dilution tables, I'm pretty sure they're in my book.
Yes, I believe they are in your book.
I think they are. I think they're in the book. So again, you need to make sure that just like everything else, you're using them accurately and appropriately. To me, it's the same thing as just making sure you're taking the correct dose of a medicine. It's the exact same philosophy of care.
So basically what you're saying is that just because it's natural doesn't necessarily mean it's safe to sort of use as much as you want wherever you want.
Absolutely. Absolutely. That's a great summation. When I teach my herbal class, I have a slide that has a picture of poison ivy, and it says, just because it's natural, it doesn't mean it's safe. Would you drink a cup of poison ivy tea? And I'm always hoping the answer is no. We're counting on it being no.
You know what? Sometimes people would probably say, yeah, sure.
Yes, that's what, I was going to say, I always count on them being, using some common sense and all this. So just because it's natural doesn't mean it's safe. We still have to use our heads and educate ourselves about the safest way to health. And so I think that's one of them.
Well, we know a lot of people who listen to our podcast actually, are mothers with babies or young children. It seems like this would even be more important to know about that. You mentioned putting lavender oil on the nipples. I know some people put peppermint oil, same kind of thing, to try to heal up, sort of abrasions and stuff. And that's concerning. I mean, especially given what you're saying.
Yes.
I'm actually rather concerning. Are there ones, I know, like things like menthol and stuff you need to absolutely avoid having around babies. Are there any other kinds of things?
I am very, very cautious. And I always laugh because, as an herbalist and aromatherapist, I'm very conservative. They don't, with the use of these things. And I think like with babies, infants, I would really not even use them applied. There are tables and you can dilute it, but I think, again, why do it when you can use it as inhalation? So inhalation is, so much easier than making sure we're getting the right kind of dilution. So the majority of times, there are times on my own children and my own grandchildren that I've used essential oils diluted properly for infants. But again, I think we always have to think in terms, what is the absolute safest way to use these things?
Okay.
Just like the eucalyptus.
Yeah.
You can make it into a little chest rub. You can do a good little chest rub to help clear their sinuses. But for an infant, I don't know. So why not just sit and read a book or play with them or whatever, or nurse them, sitting there with the essential oil out into the air for them to breathe in. So I think we always need to be on that pathway to be thinking, what's the most effective and safest way that we can help these little, especially babies, get healthy, get better.
What do you think about these diffusers, that you put a couple drops in and it diffuses into the air? Do you like those versus?
I think those are great.
Okay.
And many of them, they're kind of pricey. And but in the long run,
Walmart's carrying them now, and they're about $7-8. Yeah, they're not bad.
Wow. Okay.
Yeah.
That's
Yeah, I know. I just saw them the other day.
Wowie, kazowie. But in the long run, generally with diffusers, you use less in the long run. And so essential oils are not inexpensive. They are kind of pricey. So you can do that. You can also, I always call it the poor man's diffuser, is that you can take a cotton ball and put, 5 to 10 drops on a cotton ball. And, if you're like rosemary is a great essential oil to kind of help you keep your focus. And if you're working on projects, rosemary will help you stay and those kind of things. And so put it on a cotton ball, set it on the table right next to you while you're doing long projects. So there's a poor man's diffuser that works really well. They also have the little either metal or sometimes they're porcelain lamp rings that you can get for a couple bucks. And you put a couple drops in there, put it on a light bulb, and it's a nice gentle diffusion out into the air. So there are ways to do that. That's very inexpensive and still fairly sparing to the amount of essential oils that you're using. So,
and it sounds like a really kind of a safe way to use them.
A very safe way. So yes, I used to work in a birth center. And so of course our moms were always looking for more natural ways to help them with labor. So we used the little cotton ball and they would pick out whatever essential oils were comforting. We always only use the safe ones, obviously. But put a couple drops on there and then we would safety pin it to their pajamas or gown or whatever they had on. And that was another easy way to do it. Or hydrotherapy. You can put it in a hydrotherapy tub as long as you're using the correct amount.
Okay. So just if you're talking probably a couple of drops, you're not talking about,
the drops. We usually put in a hydrotherapy tub, we usually put 7 to 10 drops.
Okay.
And that's really all you need.
That's all, and that's in a lot of water.
And that's in a lot of water. So yes. Yeah.
Well, I think you've given, hopefully people some food for thought, because I agree with you. I'm concerned about, the mounts and stuff that people are recommending.
Yes.
So, and it's nice to actually kind of hear, and, also that the fact that you come from that nursing background. So you're, thinking about it in terms of like the overall picture of patient health. And I think that's important too.
I appreciate the opportunity, and hopefully more and more people will be using these essential oils in a healthier, safer manner. So that's definitely my hope as time goes on.
Yeah, no, I hope that too. Well, so if you're interested in more information about essential oils, we're going to plug her book again.
There we go.
Families by Donna Walls, master herbalist, certified aromatherapist, also nurse, lactation consultant, and childbirth educator. So thank you for tuning in today, and we look forward to seeing you on another broadcast.
Thank you. Bye.